Now, I want to finish with what I see as being one of the biggest challenges to those of us that do pharmacoepidemiology studies. And I've got here a graph produced by a PhD student of mine called John Tazer, and it shows you the explosion in the number of studies published using electronic health records. Now, I started doing these kinds of studies here in 2005, and this is just primary care publications from using UK data. Okay, so it's a small field, but it's representative of the rest of the world. And there were about 75 articles a year back in 2005. In 2017, there were 225 articles a year. And this is the same, whatever data source you look at, there's been an explosion in the use of these data. Now, what I would say is, what really matters is quality, not quantity. So, in a way, it's great that the data are being used more and more, but we want to make sure that the evidence that they generate is good. And I see all the time examples that are very often published in widespread media that everybody reads, where I can see that there are big problems. So here's an example, it's again from a UK newspaper, and statins are often in the news for causing problems, and it will often then lead to people stopping their statin. What we do know is that statins do prevent heart disease, so we know that people stopping their statin will lead to heart disease. And often the reason that they stop is because they're worried, because somebody's done a study where they show an association between statins and some harmful effect, which then gets misconstrued as being causal. So I think this is a problem. Another recent example is the proton pump inhibitors. Now, I have a personal interest in PPIs because I think that they get blamed for a lot of harm that they don't cause. And here was a study that showed people on PPIs being more likely to die than people not taking PPIs. And I agree, I'm absolutely certain that the sort of people who get given PPIs die more often than the sort of people who do not get given PPIs. I think it's because they're sick, not because the PPIs are killing them. I think it's very hard for us to prove that or to show that using observational evidence. But my worry is that people see these kinds of headlines and then decide to stop taking their PPI, which is actually giving them relief from gastric symptoms. So I think that this explosion in the use of data to generate evidence brings a big problem in terms of how we communicate and how the wider world understands evidence and causal associations. Okay, so to quickly summarise, so I think pharmacovigilance has developed massively over the last 50 years. Pharmacoepi is a very important tool for us to assess several different areas of pharmacovigilance. It's fully embedded in the risk management process throughout the world. There's a massive growth in the use of electronic health records to investigate the effects of medications, and I think we need to be extremely careful how we interpret these studies and that we do the best kinds of studies that we can, because we're trying to get to causal effects, but it can often be very difficult. Okay.